So I'm going to get started. Thank you all for joining today's webinar. Before we begin, though, I'd like to cover a couple of technical issues. So if you come across any problems, please chat to the host, who you'll see is CTAC admin. If there's any technical issues, you can find the chat box on the bottom of your screen, a little chat bubble. At the end of today's webinar, so as we go through today's webinar, we encourage you to chat in any questions or comments you have. We'll be accumulating those as we go through, and we'll save them for our Q&A period at the end of the panel discussion. And please help us out by completing a brief survey at the end of today's webinar. You'll get it, and complete those and give us some ideas. Of course, how your satisfaction with this offering, but also any other topics you would like to have covered in this area. Thanks again for joining us. Let's get started. On behalf of the Community Technical Assistance Center of New York, it's my pleasure to welcome you to today's webinar, Adding High Value Through Trauma-Informed Care, an Evidence-Informed Paradigm in Business Practices Across Systems. Part one of this series, so this is the second part, focused on the available evidence supporting the value of trauma-informed care, not only as good clinical practice, but actually as good business practice in an organization. In today's webinar, we have a panel of organizational leaders who've been working on aligning their organizational policies and practices with trauma-informed care principles. My name is Jim Rodriguez. I'm the Director of Trauma-Informed Services at CTAC and the McSilver Institute for Poverty Policy and Research, and I'll be moderating this webinar. The facilitator of our panel discussion will be Dr. Tony Salerno, our practice and policy scholar. And then I want to introduce our panelists today. So on our panel today, we have Kristin Rasmussen. She is the Chief Operating Officer for ICANN. She's worked for ICANN for over 10 years. ICANN is a nonprofit provider of innovative home and community-based interventions in upstate New York, and provides services to over 1,900 families daily through 20 programs across 6 counties. It's a huge organization. And Kristin has over 32 years experience in the field of behavioral health, and has spent the majority of her career working as a social justice advocate, and the unique ability of creating safe environments where folks can bring their authentic and whole services into space, very consistent with trauma-informed approaches. And also from ICANN, we have Jeremy Butler, who's the Director of Community Initiatives, and he has over 23 years experience working in the area of behavioral health and mental health. And he's responsible for all ICANN school-based juvenile justice and training and education programs and services. He's the current co-chair of the Mohawk Valley Regional Youth Justice Team. And he's also currently a teacher of Madison Oneida's BOCES, corporate leadership and development consultant, and an experiential learning ropes course facilitator. Always enjoy participating in ropes courses. And we also have Ivy Gamble-Cobb. She is the current executive director and one of the founding members of the Family Center in Brooklyn, New York. She's previously worked at the New York City Department of Social Services, the Division of AIDS Services, as both a family case manager and a program planner. She received her bachelor's from New York University, her master's from Hunter College School of Social Work, and has earned credits towards her PhD in social welfare. And she's been featured on videos, Remembering the Sun and A Gift for My Children. Families talk about custody planning, and has also co-authored articles on the issues of families affected by parental illness. And then lastly, we have Larry Bolano. Larry Bolano is the CEO of Resilient Health. His educational background includes a master's degree in business counseling and philosophy. He's a licensed professional counselor in Arizona. Larry is our one out-of-state representative on this panel, and we're happy to have him, although he's formerly from New York and back with us. He's a certified business coach and holds a certificate in nonprofit management from Arizona State University's Lodestar Center. And he's worked in behavioral health for over 24 years, holding a variety of leadership positions at the provider and managed care levels. With our panelists introduced, I'm going to turn it over to Dr. Tony Salerno. Tony, you want to kick us off?
Sure. Thanks so much, Jim, and welcome everyone. we really have a very special opportunity here, to hear from three leaders, and who can share, their journey related to adopting some of the principles and practices, of trauma-informed care, and also resilience. You're going to hear about that, as well. I've been involved in this area of supporting organizations to adopt trauma-informed care approaches for about 11 years, doing a lot of learning communities across the country. And I must tell you, I've had a lot of conversations with leaders who, after we chat about, what is trauma-informed care and why is it important and what does it take, they say, well, thanks, but no thanks. For whatever reason, they just don't see themselves in a position to be able to kind of move forward. You have three leaders who experience all the challenges and all the difficulties that organizations do these days, but have decided that they will engage their organization in a change process, and sometimes a transformational process, to really bring what we know about best practices related to addressing the needs of folks who've experienced significant adversity in their lives. And so this is a really special opportunity to hear from them. And as the leaders who've joined this, you'll have an opportunity to kind of really ask some of the critical questions that you would like to have answered. But instead of hearing from Jim and I as academics and theoretical approaches, you're really hearing from folks who are in the field. So we're going to start off with, Larry, kind of sharing tell us a little bit about your organization, and really why you even bothered with this. What was the journey like of why you said, yeah, there's 100 things you could have done, Larry. I have no doubt about that. But you said, no, we're going to really put time and energy into this area of trauma-informed care. So if you can share a little bit of that with us, that would be great.
Thank you, Tony. It's so good to be here. I was kind of joking around with the team. I grew up on Long Island, and then we moved down to Arizona. So I feel like I could use my full Long Island accent today and not have people be weird, like you say things funny. So it's good to be with this group. Why bother with this? Well, I think we go into the fields in which we need the most help. So here I am today with all of you. And when I joined this company back in 2018, it's called Resilient Health today. But when I joined in 2018, the company was called PSA Behavioral Health, and that stood for Presbyterian Service Agency. And the company's been around since 1971. And just as a quick overview, we have about 10 sites over Arizona. Right now, we have about 4,000 active. We call our people participants, the kids, the families, the adults that we serve. We call them participants. And we offer a host of community behavioral health services, including integrated care, primary care services. We have counseling services for the seriously mentally ill. We do housing services, first episode psychosis, children, adolescent, just the full range. And when I joined and I was traveling around, visiting our different sites, it became very clear to me that our staff here were pretty trauma informed, and they were very good about understanding trauma and realizing that, sometimes we need to do things a little bit differently. And maybe verbal therapies are good, but maybe we need to complement those with some nonverbal therapies like the therapeutic arts or art therapy. And so as I was learning more about this company, it's like, well, we're very trauma informed, maybe even trauma responsive. I started learning more. This is also about my personal journey, learning about trauma. And as I started reading different books, and my clinical leadership here was saying, Larry, check this out, read this. And as I was learning more about being trauma informed and trauma responsive, it's like these 5 areas kept popping up in my reading. So I kept reading about emotional regulation. I kept reading about being able to connect with other people, having strong relationships, having a sense of achievement in life, that ability to get things done, having meaning and purpose in life, and really having being healthy, being real healthy. And so, I don't know, one day the light bulb went off and I'm thinking, all these 5 elements that are connected with trauma, maybe that's a way to understand resilience. And maybe if we were to work on these 5 different areas, we can focus the energy of this company on resilience. And instead of thinking of us as a mental health, behavioral health company, maybe at our core, we can be thinking of ourselves as a resiliency building company. And maybe we can focus on that. And maybe we can have a purpose statement that kind of solidifies that. So we kind of kicked around different purpose statements, and we came up with our purpose is really to unleash the power of our employees and our participants to create a resilient world, one person at a time. So that, along with our values, our 4 values, our values were developed by our employees. We didn't, our board of directors, my team and I, we didn't come up with them. We asked our employees, what do you think our values are? And each site did a different process. And it came back that they said, we are, the way I remember these is CARE, C-A-I-R. We are compassionate. We are authentic. I think, Tony, James, you brought that up with respect to ICANN, that being authentic, that's very big in trauma. We're innovative and we're respectful. So those 4 values, along with our purpose statement, I look at those as our company's kind of our DNA, kind of our, our genotype, so to speak, of who we are, and our kind of our phenotype, how we express those things, is everything that we do, the people we hire, what our facilities look like, the programs that we use, the policies, what conferences and panels we're on or not on. Everything we do is a reflection of that. So that's why in 2019, kind of decided, let's change the name of the company, not just to change the name and be, trying to be cool, but to do a psychological repositioning of the company and focus us on building resilience. So that's kind of been my journey. I can certainly talk more about. I know we're going to talk more about that.
Yeah, terrific. Thank you so much. So much, Larry. That's great. Ivy, could you share a little bit about your organization, who you are, and what your journey has been like?
Absolutely. So good afternoon. So I'm Ivy Gamble Cobb. I am one of the founders and the current executive director of the Family Center. The Family Center has been in existence for 27 years, providing comprehensive social, behavioral health, legal services to families impacted by illness, crisis, or loss in New York City. We started at the height of the HIV epidemic, primarily focusing on ensuring that all families had a future care plan in place for their minor children, and over time have greatly expanded our service model to meet the emerging needs of families in New York City who are dealing with a variety of issues. We took on trauma-informed care about 4 years ago, recognizing that we're working with populations for which there are high rates of childhood and adult trauma. And we were increasingly using evidence-based interventions to treat those trauma symptoms that we were seeing in adults and children. And we serve children as young as 2 years of age, all the way up to grandparents well into their 90s who are caring for minor children. We knew that in order to best serve our clients, we needed to make sure that we were maximizing emotional safety in all of our work and minimizing, and this was really important, minimizing the risk of re-traumatizing or alienating our clients. And so we decided to really take a systems approach as an agency and looking at a trauma-informed approach in every aspect of the agency, from how we greeted people from when they came in the door, what our facilities looked at, what were the types of interventions that we were offering to our families, really making sure that every aspect of the agency, every way that we worked with each other and with our families came through that trauma-informed lens.
Tony, you're muted.
Sorry about that. Thanks so much, Ivy. Very much appreciate you sharing that, that journey. And Kristin and Jeremy, if we can hear from you as well. Maybe Kristin, we'll start off, or Jeremy, we'll start off with you.
If you don't mind, I'll jump right in. So
Terrific.
First, I want to thank both Jim and Tony and the CTAC team for inviting all of us here. And I also want to thank the 113 people that I see on the call right now. I appreciate you choosing to spend some of your time with all of us. I'm hopeful that what we're able to share today is going to resonate with many of you, and that this will be the spark of conversations that will get you thinking a little bit differently, maybe, or even reinforce some of the things that you're already doing. And Kristin and I are both excited to talk to you from the perspective of ICANN. And just to give you a little bit more background of who we are and kind of what we do, as Jim said, we're a fairly large nonprofit organization that provides mental health and behavioral health services here in the Mohawk Valley in upstate New York. But that wasn't always the case. We started about 25 years ago. I believe we're in our 25th year. And we started as a pilot project, actually, with our county government, recognizing that we had a high number of youth that were being placed in out-of-home care. And we all know that out-of-home placement tends to be one of the most expensive things you can do, and oftentimes is one of the least effective things you can do. So they created ICANN and then Kids Oneida as an organization to prevent out-of-home placement. So the idea was, hey, if we could put the supports and services in place in the home, in the community, maybe we can keep these families together. And that's really the vision of our organization, is keeping families together. And this evolution that we've been on for the last 25 years has helped us grow into an organization, as Jim mentioned, where we now have over 20 different programs and services that we offer as an organization. We service youth all the way prenatally to end of life, with that goal and that vision of keeping families together. And so in some cases, it might be helping to keep an elderly individual in their home and out of a nursing home placement. For children in my school-based programs that I get to oversee, it's keeping them in the least restrictive learning environment possible, so that maybe they don't wind up in an RTF placement because their behaviors are so challenging. And so we've seen this evolution, and what started out as a handful of employees has now blossomed into a company where we have over 180 full-time employees. We have a provider network of over 40 provider agencies that have close to 250 providers as part of that. And it's really this really nice, robust network of people who really care. And when we look at it from the trauma-informed lens, I think what Kristin and I hopefully will be able to share with everybody today is maybe a different view of that. So I'm hopeful that you get to see kind of both ends of the spectrum in terms of how trauma-informed work can be integrated into your organization, because I think our organization was fortunate and we took more of an organic approach. And when we talk about kind of our guiding philosophy as an agency, we're built on the principles of high fidelity wraparound. And while wraparound has its own core tenets, if you look at many of them, they align greatly with trauma-informed care. So really, in a lot of ways, we think we were kind of ahead of the curve 25 years ago, already stepping off in a place of trauma-informed work. So I'm excited to share kind of what our growth and evolution has been as an organization, how we do things that maybe you can think about differently, and how you might be able to incorporate them into your organization. And really to be able to answer any questions that we may be able to provide you with some insights, highlights, or knowledge of in terms of how we've chosen to do things. So really excited to be here with all of you.
Thank you so much, Jeremy. Kristin, would you like to add anything to what Jeremy mentioned?
I think he's got it. I think we can keep rolling.
Terrific. So, when you guys were thinking about, okay, so I think trauma-informed care would be a good thing for us to spend some time and energy. What did you hope to accomplish? I mean, did you have an idea of like, gee, if we really do this, this is where we are now, and this is what we would look like if we were to really fully embrace and adopt trauma-informed or resiliency? So like, what were you hoping would that change? So if you were in a time capsule, we started it, and then if someone was to come 5 years later and visit us, what were you hoping that would be different?
Well, Tony,
throwing that out to, and yeah, Larry,
I'll just throw this out. I think for me personally is what can we do different? Because working in our system here in Arizona, it's, and maybe this is probably true across the country, sometimes it's a very good business model. What we have is people come in, we provide services, they go through a graduation, then they're released to the world, and then they recidivate, they come back in for more. So we do more things with them, more services, graduate, they go out and, relapse or whatever happens, and they come back to us. So what I wanted to do here was what can we do to break that cycle as much, and say, how can we help people build that resilience so that when they leave us, they are actually able to respond successfully to the adversity in life and not come back and see us, hopefully, as much. We know, life is hard and it's challenging, and we're always learning and growing. But what can we do to minimize that as much as possible and build that resilience with the kids and the families and the adults that we serve? And just from a heart perspective, that seemed to be the right thing to do. But also we're talking about the business side of things too. That's also something that's appealing to our funders, to the insurance companies who are paying us. They also want to see people, go through our services and not be high utilizers of emergency departments and emergency rooms and psychiatric inpatient crisis services. So when I talk to our funders and say, we want to work on building resilience, to help keep these people out of these, these lagging indicators of these expensive levels of care. And we're going to work on the leading indicators of resilience and functional levels, those types of things. That becomes a nice conversation to have with the companies that pay us. So just from a clinical perspective, from a business perspective, it makes sense.
Great. Thank you.
Larry, I totally agree with you. It was really about giving our families the tools that they needed so that they could be successful in terms of moving on with their families, partnering with them, helping them identify their strengths and then those areas that they really wanted to grow and develop in, both for the parent and for the children. And so really being able to give them concrete tools that they could go away with so that you don't see that recidivism happening and that families are going off and they're really able to really grow and develop in healthy ways that lead to positive outcomes for all family members.
Thank you so much, Ivy. Kristin, Jeremy, Kristin.
Yeah. Oh, I'm sorry, Kristin, go ahead.
No, yeah, Ivy, I want to piggyback on both what you and Larry are saying. And I think for us, there was this immediate need to make sure that if we're saying we're a family first organization and that we're putting our money where our mouth is, that we want our staff to feel well and be well so that they can come up and give us the best care to our folks that we're serving. It was also about allowing everybody to come into this space to bring their whole selves. Because if we're talking inclusivity, right? And that's the core of what we're doing here in this organization, making sure that everybody can bring every piece of themselves here so that they can be present in a space where they're safe, they're celebrated, they're heard. We're talking to our families from the first time of engagement, really about discharging. They know their families the best. They know themselves the best. How can we ensure that they're getting what they need from us so that they can be successful, but that it's genuine and that anybody that walks through this door actually feels that? Jeremy?
Yeah, no, to kind of dovetail on that, I think one of the challenges we have as service providers is we often see people come through our doors and we expect them to change. And I think if we want to see those changes that might need to happen come to fruition, the first thing that has to happen, in my opinion, is we have to change the hearts and minds of the people that are helping those people. And so from a trauma-informed perspective, if you're looking for what maybe your why might be, if you're not currently doing trauma-informed work, it really is shifting the mindset and the culture of your organization to a place where you understand that 70% of all people experience a trauma, right? It's not just the people that are coming through your doors. And for our staff and our culture, we invest a lot of time and energy in helping our staff understand moving from this sickness model to more of an injury model. So instead of asking what's wrong with somebody, really focusing on what happened, right? The challenges that somebody presents when they walk through those doors is often a product of the trauma that they've experienced in their lives. And I think that first step, when you look at kind of the 4 R's of trauma, and there's a lot of different models out there, but that first piece of kind of recognizing, it starts with educating your team and really changing the mindset of the folks that are there to help others, to really understand that this is important, that there's science behind what you're seeing. And if you're really going to make those changes or be effectual in that service delivery, you have to approach it with this mindset. And you can call it whatever you want, but essentially at the end of the day, we're all generally talking about the same thing.
Any of the other panelists want to react to something maybe you heard from some of the other panelists?
And I think I really appreciate the focus on the actual employees or staff at the companies, because if we can't be trauma informed, responsive, if we can't be compassionate and authentic and understanding with each other, how are we going to do it with the people that we serve? So that I just appreciate the point that all the panelists are making regarding this. That's so powerful. That's the culture.
Mhm.
And I often say that I should have no expectation that the families that we serve are going to be served well if I'm not taking care of the staff who are responsible for providing those services. There's a direct correlation there.
Mhm.
And my responsibility is making sure that my team has the training and the resources and the support that they need so that they can effectively serve the families who come to our door seeking services.
Absolutely.
We actually try to hardwire that in our purpose statement. Our purpose is to unleash the power of our employees and our participants. So when I talk to our new hires, that's not an accident that we put the employees first in our purpose statement, because as this group knows better than anybody, we're a service business and we're only as good as the people who work there. So let's do all the good things that our panelists are saying today and focus on our employees to help them be their authentic selves, feel trusted and feel safe in this environment.
You know, it's interesting what you guys are saying, because for many people, they think about a trauma-informed approach where the focus is really on the clients that are being served, right? The recipients of care. But what you guys are talking about is, well, when we think of adopting trauma-informed care principles or resiliency principles, we're not just thinking about the clients we serve. We think it has applicability to how we strengthen a workforce
Mhm.
and how we develop an effective high performance workforce. Do I got that right?
Absolutely. 100%
Absolutely,
right.
absolutely. When we took on our work around trauma-informed care and begin to look at the different domains that we really wanted to focus on, many of those first domains that we focused on were staff related. We brought in the trainers. We brought in the training for the evidence-based intervention that we were using, but much of the work that we did initially needed to focus on staff and making sure that they felt supported and being able to do the work that we needed to do, and looking at every aspect of our agency, from, how we orient staff, how we bring people into the organization, how we support them throughout their life cycle of being with the family center. Many of our initial initiatives were focused on staff.
Oh.
Tony, I
Yeah, I know where you're going to go with this. I know where you're going to go with this, Jim.
Yeah.
Go ahead. Go ahead.
Yep. I was mentioning in our kind of pre-interview that I have a theory that those organizations who are trauma-informed, precisely because of the issue that you're raising, because a trauma-informed lens means sort of focusing on the needs of the workforce just as much as the recipients, that those agencies and organizations have been able to weather the storm of COVID-19, right? A mass disaster event that has impacted everyone. We're hearing stories of people leaving the profession, leaving behavioral health in droves in many ways because of the impact of COVID-19. So I wanted to know, and if you could share with our folks what the value has been in coming into this COVID-19 pandemic with that trauma-informed lens, and what you think that has done to help you weather the storm.
Well, for us, I think it's just really helped us be more compassionate as a company. Something that we, from a cultural perspective, with the pandemic, I think everybody's on edge. All of us are seeing higher rates of, suicide and addiction, and every possible bad outcome measure has been elevated over the last, since, February of 2020, March. So I think having this trauma-informed lens and really, again, coming back to our staff, doing a good job to celebrate those successes, the things that are going right, focusing on those things. I mean, one of the first things I remember sitting at the National Council back in the days when we used to go to conferences, I sat in the first row at Tony's presentation at NatCon. And one of the many things that he said that kind of, left a mark on me is you could tell how trauma informed a company is by how much time they spend on assessing strengths. And by the way, Tony, we changed our strengths piece of the assessment to be more than one line. So that was what it was before. So we said, better take a look at that.
Well, that's better than my experience, Larry, where it was basically one line to kind of fit all the strength. So I used to write really small so that I could put as many strengths in there as possible.
Right. So my team's, one of the phrases I use is, what can we hardwire? How can we hardwire these things into the culture so that we're automatically doing them? So every meeting, my strategic leadership team, our key operational meeting with all of our key leaders, we start out with recognizing successes and celebrating successes and strengths of the company. That's just something we do. We write thank you notes if we need to. We do whatever we can to kind of start off on that approach. And then the other thing we do is, whether it's my team or our management team, we do some grounding and breathing. We take time to take care of ourselves. We spend time on the agenda, at the start of the agenda, to do some breathing exercises. And just from our management team, we have a different manager who may lead our meeting each month. Each of those managers, whether they're a clinical person or not, they come in with some kind of fun grounding or breathing exercise. That way everybody has a chance to practice it and do it. Because again, it gets back to, if we can't do this with ourselves, how can we do this with our clients? So I think that's been good, having that extra level of compassion during the pandemic because of all the stress that our employees are going through, not just our clients, but our employees are going through as well.
Thank you.
And I think that's a perfect segue to what I want to share in terms of what I saw our organization do. So you go back to what I said earlier in terms of one of the biggest challenges is changing that mindset. Well, in order to change the mindset, you have to get buy-in. And I think one of the things the pandemic did for all of us is it created a sense of empathy, right? So when you're working with clients, it might be hard for you to empathize what they're going through because you don't have that same lived experience. But here through this pandemic, we all were going through kind of a collective trauma. And while that impacted us all in different degrees, there was an empathy, I think, that was created. And so I think it helped staff buy into the why. And as an organization, what we were able to do, it was March 13th that we sent notice to staff that, hey, you're going to be working from home on Monday. And it didn't take more than a week for us to set up services for our staff. So we did things with intention to say, hey, we need to create intentional checkpoints and touch points for our staff to be able to engage with each other and to connect. So kind of what Larry was talking about in terms of self-care, every Monday we did Mindful Monday. And Kristin and her team have a unique skill set that they were leading our staff through meditation and mindfulness, yoga exercises. And I've openly shared that that's not something I would have been comfortable going to in person. But when I can hide behind a screen in the comfort of my home and turn my screen off, I actually was able to engage. And those were optional things that were available for our staff. And on Wednesdays, we did a thing called Walk and Talk, where we just invited staff to come in at noon and we would link them up in breakout rooms where they'd pair up for 3 minutes, meet somebody, have a conversation, meet another person. And I think even though not 100% of staff utilized that service, just knowing that that was there. And again, our focus was on them. It wasn't so much what can we do to support our clients. Going back to what Kristin shared earlier, if our staff are well, we know they're going to be able to give the most for our clients. And I think through those efforts over the course of the past 18 months, I think they've made all the difference in terms of getting staff buy-in as we've grown as an organization to really understand why this work is so important.
Thank you, Jeremy. Ivy?
Sure. The pandemic, that Friday, we were all in the office, and on Monday, no one was in the office. And it was very traumatizing for our clients as well as for our staff who found themselves at home trying to manage work, their family, their children. And so we really paid a lot of attention to how could we support staff in moving to this remote environment, and also support our clients, because kids were now home from school, where parents, the anxiety levels and many of the households were off the charts. So one of our focus was, how can we mirror the experience that clients had in the office in working with their therapists, and recognizing that many live in small apartments and there is not a lot of privacy. And so, we sent white noise machines home to our clients. We mirrored the therapy tools, especially for our young children who may have been involved in play therapy. So we sent those tools to the home so that your therapist may have been on screen, but you still had the same things that you would normally have in the office. And then we looked at our staff and we realized that they needed a lot of support too. And we sent care packages to all of our staff as well, aromatherapy, the pressure balls and things like that, coloring books. Like sometimes you just wanted to zone out and color. And we made that space for our staff to be able to do that.
Oh, terrific. I think that's such an important point that all of you are making, is trauma-informed care is not just about treatment for people or clients we serve. It is I think, Jeremy, you mentioned a mindset, right? In a way, it's a value system, as Larry was talking about, that we're driven by certain kinds of like values, and it applies to all the humans. It applies to like all the humans in that environment. No one is less human than someone else. And that's like a very important, piece to all of this. So, when you also think about, there's a couple of things. One is that there's a benefit to the clients. There's a benefit to the staff. There's a benefit to the organization that, you had mentioned, that the belief is that if we do this well, it's going to actually improve our bottom line business practices, right? And I'm curious to know if Ivy and Kristin and Jeremy, do you guys see that in this way? Your journey wasn't like, oh, we're going to do this because we'll reduce turnover. Oh, we're going to do this because, we will have people who won't end up in the hospital as often. It didn't sound like that's really what was driving you. It was a whole value system, that this is about quality. This is about addressing the needs of a population where there's such high levels, such prevalence, of trauma in their lives. But that it also, perhaps coincidentally, is likely to benefit those hard-nosed business sorts of like indicators. Could Ivy and Kristin, perhaps, do you have any, and Jeremy, any thoughts about that as well? Are you hoping that that's going to be one of the outcomes of continuing to adopt these approaches?
I mean, one of the best outcomes that we saw from taking this on is just the engagement level of our clients. Very often, some of our clients were hesitant to engage in care for a number of reasons. Their lives are complex. There's a lot going on. But what we did see is a great increase in terms of engagement. Our clients really engaging with their therapists, remaining in the care, really going through the entire intervention. So for us, that was a great outcome. And also, I think an outcome for the staff was it gave them more confidence in doing their job. And it was wonderful to see staff grow and develop and really build their confidence level, because very often they were questioning whether or not what they were actually doing with the families was having a lasting impact. And when they saw that, because of the greater engagement, you could see the correlation in terms of their own confidence.
Wow. So those are like really important successes that you experienced. And Kristin and Jeremy, any other successes that you see it's associated and related to your efforts around trauma-informed care? And then Larry, I'd ask if you could follow up with them as well, okay?
Yeah, I think an important word that you shared was quality. And when you look at the bottom line and you look at what funders want, while we can do the greatest job of shifting the mindset of our company and our culture and put those values in place, we're in the challenging position oftentimes where we've got to work within and with systems that maybe don't have a trauma-informed mindset. And oftentimes there's a lot of resistance. And I can speak to that specifically with my school-based programs and working with schools. And you look at old day treatment models where it was more punitive based and timeout rooms and consequence driven. And to come in from our perspective and taking a more trauma-informed approach of, hey, what would this look like if we don't do any physical interventions? What would it look like if the timeout room now becomes a positive place, a calm corner, or the school store? Getting buy-in on that was a challenge. But what happens over time is that quality. You start to see kids transitioning to a less restrictive learning environment. They're not going to higher degrees of care. The cost drops, right? And so it's not necessarily cost savings, but it's cost avoidance. And when you can quantify that, when you're able to show and demonstrate those outcomes, funders have no choice but to say, okay, maybe I don't agree with why you're doing it this way, or how you're doing it, or your mindset for how you're doing it. They can't argue with the results. And so when you have those results, you have more people that want to come to the table and want to access your services and your way of doing things, because undeniably it's working.
Oh, terrific. Right.
Yeah.
Larry, could you maybe add a little bit to what
I
your
think
experience is like?
what Kristin, Ivy, and Jeremy are saying about engagement is so powerful. I think that's one of the biggest shifts to make for us as providers, is to realize engagement is different than treatment. And engagement comes before treatment, and we can't even think about treatment. And let's have the people at our companies like a play. Let's have people doing the right roles within the play. Let's have our treatment people doing treatment, and let's have our outreach and engagement people doing outreach and engagement. We're working with one of the health plans, just talking about outcomes and the business side of things. And again, this is not the driver of why we do this. This is just a kind of a lagging outcome measure. We did in one of the smaller cities in Arizona with a very focused population with one of our health plans. He said, let's really work on engaging and reaching out to individuals who are hard to engage and engage in treatment. And so we did things very differently with this population. And it turns out over, 6 months worth of time that we reduced hospitalizations around 60% and saved almost $200,000 in unnecessary hospitalizations working with this population. And this was just, in a little town in Arizona doing things a little bit differently. And little things differently are things like sending birthday cards to people just out of the blue. And actually it gets bigger than that. It's the health plan realizing that maybe we're not going to make you enroll somebody. Maybe we're going to pay you a engagement fee that you don't need to worry about billing for. You take this engagement fee and use it as you need to use it. So if you need to go have a lunch, bring somebody to a McDonald's or something, or drive them and literally buy a new driver's license for them, or write some nice birthday cards to people. We want you to do those things that are a little unusual. That way you can engage people. We had one person who we sent one of our wonderful staff sent a birthday card to him, and he was somebody who didn't want services, wasn't engaging. He came into one of our offices and said, "Thank you. This is the first time in my life I've ever got a birthday card from anybody." Oh. And everybody was excited to see him. And did he sign up for services that day? No, he did not. He just came in to say thank you for the card. But you know what? A week or two later, he said, "I think I'm going to sign up with you guys. Let's do this intake appointment you're talking about. And not only are we going to do an intake appointment, I'm bringing my girlfriend in because she has some challenges too, and I want us both to get help here." So a thing like a little card that shows caring, is big. Little things are big things.
You know what I hear?
Tony, I just wanted to jump in because we're at 12:45. I wanted to mention to folks, so very quickly, we're going to do a little, because unfortunately, we're going to lose Larry. We're so saddened to lose Larry. He has a conflict at 1. What we wanted to do was, if anyone has a specific question, so we're going to do a little sidestep here to Q&A, but if you have a specific question for Larry, please feel free to put it in the chat. As we wait for that, I do have one that I think is a great one, and I can put it to you, Larry, and then we'll see if others come in. And then, of course, others can answer. But so one question that came in, which is wonderful, going back to the initiative, right? A question came in is, did you have buy-in from all employees from the beginning of the TIC initiative? And I'm going to add to that, if so, or if not, what did you do to increase that buy-in as you moved into this initiative and this work?
Okay, that's a great question. So this is going to sound arrogant, and I know this. So I got buy-in from probably the most important person in the organization to have buy-in. That was me. So I started with me. Am I bought into this? Am I going to make the decision, the conscious, Kristin and was using the term intentional over and over again. Am I going to make an intentional decision to buy into trauma-informed, trauma-responsive resiliency building? Or am I in? Am I all in? Am I, kind of in? So that was the first person I had to check with, was me. Am I in? And I'm in. So the next step was to work with my team, with my group of leaders. Are they in? And the way I do things is I don't have a consensus model here. I don't wait for everybody to be on consensus before we make a move. Otherwise, we'd be paralyzed, right? As a company, we'd never move. So we have something that you're all familiar with, a commitment model. And that's a model where we want our, somebody mentioned buy-in. We want to get our teams weigh in before we get their buy-in. So that's our time to get real messy and process and duke it out. So we're going to get their weigh in to get their buy-in. And if we go through that process and they're still not bought in at that point, but we've heard what the objections are, we've heard the 5,000 reasons why it's going to fail or not work, and still say, okay, we heard you, James, we heard you, but are you committed to moving forward with us? Because that becomes the defining moment for, I'm picking on James right now, the moment, are you on the bus or are you off the bus? Because it's okay. We'd like to have you on the bus, but we don't need you to be on the bus. So that's the model that we use. And overall, it's been really, it's been amazing with our staff too, because like I said, when I visited our sites, the people who work here, they get it. It makes sense to them. There's nothing in trauma informed that is in opposition to their values or their why for being here. So it's been relatively easy. It's been an easy, not just a sell, but I asked our new hires each couple of weeks, we do our new employee orientation. And one of the questions I ask our new hires is, why'd you join us? In this labor market, you can go anywhere. You can move to New They'll probably hire you tomorrow because you're a wonderful person. Why did you come here? And what I like hearing many times is, well, I'm hearing you guys are doing things a little bit differently. I'm tired of just being a paper processor and going through processes and forms, and I want to be able to help people. And I hear you're working on resilience, and that sounds really interesting. So that's been one of the big value adds too. So.
Wow. Terrific. Jim, did you want to see if there are other questions you're on mute?
Sorry. Thank you, Tony. Well, I do have a comment. Just someone who really appreciates, Mary Dina really appreciates your opening statement and hearing about how it went from initial epiphany to mission statement, and the name change of the organization. So, just a comment so far, no additional questions. So I think we do have some other questions. And again, we'll get others' thoughts. So for the rest of the panelists, please, sort of think about your responses as well to the question about buy-in. There's another question that's very kind of sticky, and it's actually a good one to address by you and the other panelists. But, as we talk about this focus on employees and focusing on the staff and the workforce, this could be tricky, but there's a couple of questions around the same theme. But how do you approach poor performance from an employee in a trauma-informed way, but still lay out clear expectations and possible performance plans? And I think the couple of questions that are coming in are also kind of relative to this crisis that's going on right now. So in many ways, I think that focus that you're all talking about, that on the workforce, but I suppose to summarize that question, it's like, how do you deal with those performance issues as well as being, sort of in a trauma-informed way?
So one of the things that we did, James, was about a month ago, 2 months ago, maybe, we just eliminated the concept of an annual performance review. That was a concept that we've all very familiar. I think some lawyer developed this back in the 1959 or something. Somebody got sued, and we have to do performance evaluations now every year because that's the way it's always been done. So we said, wow, maybe, and I like this phrase, and again, this is not a commercial for the National Council. I was at National Council last year, and one of the presenters on the HR side said, instead of doing exit interviews, wouldn't it be nice if we could do stay interviews? And so what we did, was we said, oh, annual performance evals, we're going to flush you down the toilet. We're going to replace that with a monthly check-in. And the monthly check-in is a structured thing, and I'm happy to send this out so you don't have to recreate anything if anybody wants to take a look at this. It's really about setting our employees up for success, looking at things like the Gallup survey, the 12 questions from First Break All the Rules, those things that the Gallup, after they surveyed thousands of different companies and hundreds of thousands or million employees, they found these 12 pieces, these 12 questions that if we can say yes to those as companies, we're probably going to be able to keep our best and brightest people. So we hardwired the top 6 of those 12 questions into our monthly check-ins to make sure that our employees are being set up for success. Little things like, do I know what's expected of me at work? Do I have the tools to be to do what's expected of me at work? Am I praised at least once every 7 days for doing something right? Do I feel like I get to do the best I can do every day? And that's just a small part of the monthly check-in. But we're talking about what were the successes from last month? What are the challenges that we're having for this month or next month? How can I support you? There's a little thing in there. How can I support your resilience as your supervisor? So we're really, we're especially in this labor market, let's not have any more exit interviews. Let's have structured monthly conversations to keep our people, set them up for success so there's no surprises. And then we total them up after the whole year, and that's your merit increase. Whatever the scores were, we figure it out. That way we're not having to figure, I'm not looking through emails over the last, what happened with my chief clinical officer. I have it all ready to go for me.
So
Larry,
Larry,
that is amazing.
We're excited, obviously.
Exactly.
Go ahead,
so
Ivy.
Larry, that your performance evaluation or your stay evaluation, I forgot is very popular right now. So yes, if you could please send that along.
Yeah,
and folks on the webinar, we will, if it's okay with you, Larry, we'll actually post that with the video and the video and the slides from this presentation, or the recording.
I cannot wait to get that, Larry. That just sounds absolutely phenomenal, because the annual performance evaluation is the bane of my existence. I hate it. We go through the process. It's arduous. And at the end of the day, I really don't feel like we've gotten any better information than we started with. So I'm looking forward to getting that. I think for us, it was around setting clear expectations, and having conversations with staff about what those expectations are, making sure that they are clearly delineated, revisiting them when employees are not hitting the mark, and finding out what kind of support that they need in order to be able to hit that mark. It's very similar to, when my daughter was in school and report card time would come around, and I always said to the teacher, if I get a report card and there are some bad grades on there, it's not her fault, it's your fault, because why weren't you communicating to me that there was a problem? And that's the same message for my managers. If I'm reviewing annual reports, performance evaluations, and I'm seeing all of these deficits, my question is to you, not to the employee, because what have you been doing over the last few months to support this individual staff member and either improving in their performance? What supports are you providing, and or having the conversation with them? Perhaps it's no longer a good fit. But if your evaluation that you're asking me to sign off on has all of these deficits and these haven't been addressed prior, my issue is with the manager and not with the staff member.
What I'm hearing really is, when one adopts those values and principles around trauma-informed care, one, it's designed to promote healing relationships. So that's one aspect of it, right? Just to recognize the vulnerabilities of humans. And so it's trying to create a humanized environment. right? That helps people to really heal. The other side, though, it's not just about healing. It's also about thriving, and it's about growing. And that's the other piece of it, that we're really looking at how do we create opportunities for all the humans in this environment, right? For those who need healing, that we're able to provide an environment that heals. But we're not going to just stop at that, right? It's also how do we create environments of growth and where people can really thrive. And that trauma-informed care can provide us with some of those values and principles that might lead us to say, this annual performance thing really stinks. It doesn't heal anybody, and it doesn't seem to be associated with thriving. And if anything, it could be traumatizing for people, right? You come in, why didn't you let me know? You waited 12 months to tell me that I kind of stink, right?
Yeah.
And, so it's, yes,
Yeah.
Kristin.
But what
Lawyers
you're
are
talking
happy.
about, Tony, is, and we did the same exact thing. Larry, that is, you saw our excitement when you said you did that. We did the same thing. And actually, I took it off the table with my team at the very end of when we were getting ready to roll it out. And I think they were ready to flip the table. But I said, this is just doesn't work for us anymore. We are really good at supervision. We are an organization that believes not just clinical supervision. We do biweekly supervision. Every staff member in this space gets that from their supervisor. It's sacred time where you're in an office for an hour and a half. There's no phone in front of you. It's aside so that you can be present and hold space for that individual. It's that intentionality again, where there should be no surprises. You should never be in a position where you're doing an annual report or an annual performance appraisal on somebody and there's surprises. That's built in the relationship that we have with our folks. So going back to really what Jim brought to the forefront here, we manage that in the human experience and the relationship that we have with our staff. We're a flexible organization. We believe and trust that we've hired the best for our field and to provide the best care. If there are issues creeping in, we're going to look at them on a one-to-one level and understand, again, I'm going to keep going back to this, what is that whole person bringing in today? Right? What is this really about? When you talk about intersectionality and how race fits in and how folks are really coming in and feeling that they are a part of our community internally here at ICANN, you got to get real granular on that. That's relationship based. That's human experience based.
Yes.
Right, terrific.
Larry,
I'm aware
before
that
you
Larry
go,
will be
yeah.
needing to leave, so we just wanted to,
Well,
first of all,
if-
just
if-
thank. Yeah, go ahead, Jim. What were you going to say?
Larry, do you have one quick question? And this is an elevator speech, so you can leave us with this. Someone asked, what is your elevator speech for a CEO? In your case, you are the CEO, but a board for the value of trauma-informed care. Maybe you can give that elevator speech quickly, but I think the question was, obviously for many folks out there, organizational leaders who have to address this with boards and get approvals and all of that kind of stuff. Just your last thoughts on that before you leave.
An elevator speech to a board member on the value.
That was the question, yes. I don't know, you're the CEO, it sounds like you led this, but yeah.
I would just say, and maybe this is, are there any minors on the call today? I'll just, can I use a bad word?
I'll beep you.
If you would like to, so if I'm gonna, I don't know, engage a new board member, I don't know if I would say this, but one thing that comes to me, if you want to be on this board, if you want to be part of the company to unfuck behavioral health as it stands today, we'd love to have you join us. Would you like to join us through our trauma-informed, trauma-responsive resiliency building initiatives?
Yeah.
Okay, and
That's the best note to leave on, but that's it.
Great note to leave on. I'm coming to Arizona, Larry.
Awkward silence, but
Phenomenal.
reframe as you see fit.
But I think
very
Larry,
powerful.
behind that message is really the current system isn't working. I mean, that's what you're really saying. Look, we are losing a lot of people. There's a lot of suffering that's taking place unnecessarily because this system, right, is losing too many. People getting disengaged. We're focusing on the wrong things. People are ending up in hospitals. They're suffering on their loan. So it's kind of like saying that one important buy-in message is the current system is leaving so many people behind and is not addressing. And we have a new vision to really begin to address all of those issues. I mean, I think that's part of what you was summarizing in that statement to
Yeah.
the board.
And thank
member.
you. And you know, I think I went to an ACEs conference recently where someone basically laid it out and said, look, the science is clear on trauma, understanding trauma, as well as resilience. And right now, it's not a matter of whether, it is a matter of will. It is a matter of whether the science supports it, it's there. It's a matter of the will to make this happen in organizations, which I thought is another way of saying what you just said.
But Larry, because I know you have to leave, I just want to tell you, I so much appreciate you sharing. And you also add this other dimension around resilience, which I think is going to open up. And as Icon mentioned, and I know that Ivy has referenced that before, is, that's another part of the conversation, is to taking a look at how we go. Resilience brings us into a lot of the thriving and the growth areas. Trauma-informed care brings us a lot into the healing areas. You combine both of those things, that's pretty powerful combination.
Yeah. Well, I'm in no rush to hop off because I have to talk to an insurance panel right now. I'd rather stay with this crew.
Well,
So speaking of cues of danger versus cues of safety, I'm going to jump into this other call right now. It was a pleasure, truly a pleasure and an honor to be here. Thank you, Tony. Thank you, Jim, and Connor for setting this up today. It was Jeremy, Kristin, Ivy. I feel like I know you. When I'm back in New York, I want to come out and visit and say hi and have some coffee and a cannoli and go from there. So have fun, appreciate it. Keep up the good work, keep up the good fight, and keep the passion. Love you all. Thank you so much.
Thank you,
Larry. Thank you.
Okay. And of course, for the other panelists, I know those were, but of course, some of those questions, if you had anything that you wanted to add with regards to the question about a board and how you might address a board and the buy-in question, please feel free. And Tony, I hand it back.
Yeah, I think the buy-in, because people ask that question all the time. How do you, okay, you bought it. How do you get the rest of the organization to be on board with you?
My feeling is you don't put a bumper sticker on a sports car, and Larry's answer was perfect. So I'm not even going to try to improve upon that.
Ivy, so what do you think? What do you think the message? Because there could be different messages to board members. There may be different messages to your staff, different messages to even the clients or to funders.
Absolutely. And it all has to be tailored because you have to recognize who your constituents are, and you have to tailor your message to each of them because each of them are going to focus and hone in on a particular part that resonates with them. And so you have to be able to speak to that if you really truly want to get that total buy-in. If they don't feel that message impacts them or what you're trying to do really impacts them and they don't see any benefit in it for them, then it's not going to resonate for them. So at every level within the organization, from the administrative assistants to the therapists, to the care managers, we needed to tailor that message around why this was important for us as an organization, to management, to the board, and why we needed everyone to, put both feet into the pond and really, even if you were a little ambivalent, to at least come to the table with an open mind around why we believe that this, at the end of the day, is going to be best for the families that we serve and for us as an organization as a whole.
Kristin, you have anything to add to that in terms of, buy-in and what messaging so that folks are likely to be on board?
Absolutely. And I think what Ivy's speaking to is you're going to break that down in layman's terms for the folks that need it. But also it has to be, and this goes back to our conversation when we worked together initially, there's the energy that you're bringing into those spaces, right? So it's transparency, and it's also raising the consciousness of your board all the way down. It's top down, bottom up, so that everybody has the buy-in and they understand the why behind it, but that they're also connected to the why. So it's going to show if we're just checking boxes and trying to move through the process into how our action is. And Jeremy, maybe you can speak to that from a different level, because I want to be mindful that when I'm speaking at this level, that I understand it on the macro level and where our buy-in is, but maybe folks are feeling it on the bottom, and we're constantly checking in to see if that's actually their experience with us.
I think with buy-in, I think an expression I like to use is don't let the perfect be the enemy of the good, right? I think too often we try to get everybody bought in, and I like something that Larry had said earlier about giving people the opportunity to share their information, but then assert their commitment. Like, here's where we're going. You don't necessarily have to be on board yet, but this is the direction we're headed. And I think it's important if you start to look more towards the ground level, you want to engage those key influencers, right? So, and I think that works at a board level, and it works all the way down to, you know, your newest employee. Who are those people that have the ear and have the respect of other people on their level to get them bought in? If I can get that person bought in, then I can utilize that person to hopefully engage and get others on board. And it's a slow process. It doesn't happen overnight.
Right.
You know, I shared earlier, we've got 100 and something staff. I'll guarantee you, not everybody is bought in, but the vast majority are. And the ones that aren't bought in, I think, are genuinely committed to going in that direction, even though they might not be 100% of the way there.
Right.
Jeremy, I think that point is so great. You know, really looking at who are your key influencers within the organization and making sure that they are on board with the direction that you're moving in. And I think at the Family Center, we created what we call our core implementation team. And that was that group of individuals, a group of staff members who really helped drive forward this initiative.
Yeah, that's great. And we're doing a lot of that work in orientation, which Jeremy has a pretty solid chunk of that when we're onboarding new staff. We're really putting all of this right out there, right from the forefront. And it's delivered in a way of, here's what it is, but we want to know how it feels for you, right? We can say anything we want to say and check all the boxes, but what are folks feeling when they come here on every level?
Yeah. Well, one of the interesting aspects in terms of buy-in, I think Larry mentioned, is it starts with leaders. It starts with all of you. It starts with us, right? Is that we have to be buying. You know, we can communicate with words, but everyone knows whether this is really genuinely felt, and is this leader really committed to it, or just going to be a soundbite because somehow it sounds like a nice thing to say. And that's like really the critical piece. I think that's something that I came away with that I found very useful, is the leadership's enthusiasm, commitment, sense of purpose, willingness to stick to it, that we're not going to get derailed. This isn't like a nice little initiative that comes and goes. This is a way that defines, in a way, our vision and our philosophy and our value system. That's at a whole different kind of like level. Yeah. And I think that's what all of you are saying. And to tailor the communication really to the various constituents, and getting commitment is not the same as consensus, but the value of allowing people to weigh in. I like that notion of weighing in to buy in. Like, we're going to hear you out, and you may say, I think this stinks. I don't think we should go in this direction. It's misguided. Forget about it. Say, well, thank you, Tony, for sharing your point of view, but we as an organization are moving in this direction, and we need your support to move forward. At least we don't need you to be a detractor. We don't need you to kind of stand in the way. You want to be on the sidelines is one thing, but we can't allow, you know, a disruptor to this process. And it sounds like those are the kinds of things for the audience members to kind of consider as they think about, you know, communicating for buy-in.
Absolutely. And how it gets threaded throughout the organization, and where you can see it concretely. It can't just be lip service, but how are you really making meaningful changes to how you operate as an organization? From some of the things that Kristin had talked about, you know, the yoga and incorporating self-care into the day-to-day work that staff are doing, recognizing that this is hard work. You're dealing with families who are dealing with trauma, and for a lot of times that's also traumatizing for our staff. So how are we as an organization supporting them through that? And they have to see that happening in meaningful, concrete ways.
That's a very good point. Thank you so much, Ivy. I just want to make sure that we give the audience an opportunity to ask questions.
Tony, we have some wonderful questions coming in. So yeah, you read my mind. And we have some good ones. So so one that we haven't addressed yet, and I think it's a wonderful question for the panelists. What's your take on racism and bias being traumatizing? What is this intersection, and what value? And I feel like I'm leading here, but I definitely see an intersection. What's your take on the degree to which a trauma-informed approach also addresses, or not, issues of racism and bias?
I think it absolutely has to, right? A big part of being a trauma-informed organization is cultural. The old language was cultural competence. The new language is more cultural humility. But I think if you don't address that, then you certainly are missing the mark. And I think 100% racism and bias can be traumatizing for people. And I think it is in most cases for people. So I think it has to be at the forefront of the discussions, and it has to be a really honest look. I know from our organization's perspective, we're doing a lot of work around DEI. Kristin is part of our team that's leading that initiative. We've just hired a director for our organization that focuses solely on DEI in our company, and we're exploring that at all levels in terms of our hiring practices, in terms of what our board looks like, in terms of how our leadership is constructed, all the way down to even some of the trainings that I do to make sure that they're relevant and sensitive in all those regards. So I think it's absolutely critical.
I do too. And I think that, Anthony, you talked a little bit about this, Tony, a few minutes ago. It's also, so you're providing space to have those good conversations, but also being really open to hear the hard stuff. And I think that's the piece that, as a leadership team, I'm really proud of ourselves. We don't have all the answers. We're stumbling along the way. We're not a bandwagoning organization, but we also want to be mindful of where we're at in this last 20 months and how delicate things have been. Not that they haven't been that way for over 400 years, but we're very intentional from even looking at what we've done really well with onboarding and cultivating a new staff pipeline, that when folks get here, how are we mentoring, and how are we, as, and I'll just call it what it is, white leaders, allowing space around the table and sharing power, right? And power in the best way. So I think that for us, it's been having really difficult heart space conversations and celebrating where we're getting it right, and understanding that we've got a lot of work to do.
Yeah. We took on a similar approach that we did with trauma-informed care with DEI, where this has now been a year-long initiative that we've undertaken, working with a consultant, and the outcome of all of that work is actually going to seed the strategic plan that we will be starting in another few months. It was, not a easy process, because it did reveal some things within the organization. In the middle of the process, there were some breaches. We needed to take space in order to deal with some of that. But it's important, and this was a conversation I had with my board as we began to take this on. You don't get a pass because your executive director is a Black woman. Don't think that we've done it. We've got a Black CEO, so we're good to go. Oh, no, we're not good to go. And as an agency that primarily serves people of color, and an organization where most of our mid to lower level staff are people of color, but when I look at my management team, there wasn't a lot of diversity there. That was a problem. And we needed to address that and take that on. And as an organization, make a commitment with concrete goals and objectives of what we were going to do differently.
I appreciate you bringing that up, Avi. In 2019, we started our strategic plan as an organization. And as Jeremy said, that's been my lead for this organization, along with another coworker. And we realized, again, we can't have two white women leading this initiative. We need to be really mindful and call in our colleagues and lean on folks to help guide our process. We don't want to check boxes. I want us to walk away from ICANN, hopefully when I retire in 12 to 15 years, that there's a foundation and a framework that we've created and changed that is long lasting, so that these conversations are not being held at this degree in 20 years from now. And that's not rose-colored glasses. That's a goal, you know?
I just want, just as a summary, it's sort of an important issue to see the alignment of trauma-informed care with social justice, that they are very consistent, so that any organization that adopts a perspective on trauma, will lead you to those values that really overlap with the social justice type, value. In addition, people are beginning to recognize just the adversity and the impact of discrimination, of racism, of disenfranchisement. It's not in the original kind of list of trauma events, that really kind of kicked us off about 20 years ago. It's not on the list of the ACEs questionnaire, but people are beginning to recognize that ought to be another element, because that has a profound effect on a person's overall health and well-being.
Well, I think the COVID pandemic certainly revealed that in many ways that I think for many of us, we just didn't even think about.
Right. Thank you,
Absolutely.
Ivy. Thank you all for sharing that. And thank you for the person who asked that question. Jim, what else?
So a couple of questions are coming up. Back to the issue of taking care of the workforce. A couple of questions. Let me see. So the first one is, and I think this is an important one because this one always comes up. Actually, Tony and I are very familiar with this. Oftentimes when we do training, even training on trauma-informed care, there are some organizations who worry about the mere topic of trauma-informed care triggering folks and sometimes staff, right? And so one question is, how has staff reacted to being trained or exposed to trauma-informed care? How vulnerable has staff felt, if at all? And again, I say that because oftentimes as trainers, having done training, sometimes people come for a training on trauma-informed care, not realizing what it is. And then when we start talking about trauma, become very triggered. So your thoughts on that and how you dealt with that, if at all, throughout this initiative?
I think for us, we talk about that right from the jump when we're going into any type of training, that if there's anything that's triggering or that we think will be emotionally dysregulating, then we always make sure we have clinical folks around to help come in and support. It's a great point.
Yeah.
Jer, Ivy?
Well, I think, I'm sorry. Go ahead, Ivy.
I was just going to say very similar here, making sure that we create those we don't call them safe spaces anymore. We call them brave spaces for staff to really be vulnerable with each other and support each other.
The pearls that you, go ahead.
No, I was just going to say from the training perspective, it has come up. And one of the things that we've implemented into some of the training that we do around trauma-informed care is we share. I'm a person with lived experience, and in my trainings, I share some of those experiences that I've had. And I think when you do that, oftentimes you give people permission to share things that they felt that they had to lock away and couldn't talk about, but knew that were significantly impacting them. And while that doesn't always pop up in the training milieu where someone's going to come in and share something openly, that does happen, but often after the fact. You'll have somebody reach out and say, hey, I really appreciate that you shared that. I had this experience. We have, without outing one of our staff, we have one of our staff who is a military veteran who has struggled. And he, during one of those events that I shared earlier that we had set up intentionally for staff during COVID, he opened up about some of the things that he was experiencing. We had one of our events on a Friday afternoon where it just went that direction and staff were crying and sharing and felt comfortable, and we didn't call it a safe space or a brave space, but I like that language. But I think it ultimately goes back to the culture. And if you have a culture where people feel safe to be vulnerable, then I think it's going to be a little bit more widely accepted. I think it's also changing the narrative around that word vulnerability. I think a lot of people attribute that word to weakness. And so an analogy that I often will use, and I stole this from Brené Brown, this isn't mine, but if you think of it in the terms of somebody going and doing an open mic night, they're making themselves really vulnerable, getting up there in front of, singing in front of people if they haven't done it before. But that's pretty brave. That's pretty courageous to be able to do that. So vulnerability requires strength. And I think when we change that narrative around that language and that word, it gives people permission tap into that vulnerability and feel a little bit more comfortable being vulnerable.
And I think that has to happen at every level within the organization. It's not just the staff members, the therapists who are working directly with clients, but your managers from the very top have to also exhibit that vulnerability and being willing to put themselves out there.
Thank you. Jim, any other questions coming in?
So, another take on staff self-care, and I know we've talked about this, just generally providing that burnout prevention. So in many ways, I think you've addressed this issue of how do you support staff, but I think there's also in trauma-informed care, one of the reasons why trauma-informed care focuses so much on self-care is that that recognition that working with, right, you're being exposed to other people's trauma, that as you begin to sort of become more trauma-informed, you're also asking your clients, the people you serve, your participants, you're assessing that. You're baking that into the process of engagement to better understand their experiences. You're becoming braver and more knowledgeable in being able to bring that information out and assess for that and have conversations about trauma. That can also have a long-term effect. So I think one of the questions that came out had to do with kind of burnout prevention and the length of time and how you deal with, if you open up, as we were just talking about with staff, right? As you open up those issues, it can also create the conditions where burnout, secondary trauma, vicarious trauma become real. So your thoughts about how do you do that as well as you promote folks doing this work more?
Anybody want to jump in?
I was going to say we're all being super polite to see who wants to go first. I'll always happily jump in, and I'll drill this down to a program specific level because again, in some of my school-based programs, we're dealing with really challenging behavioral kids for 6 to 7 hours a day. We're making that shift away from physical intervention and as I shared earlier, and with that, there's a lot of opportunities for that vicarious trauma. And one of the things that we've implemented in those programs is mandatory debriefing. And you see this oftentimes, law enforcement community is moving in that direction where you require someone to have to meet with somebody, because I think the notion is, no, I'm okay, I'm good, I've got this, I'll go home and recharge my batteries. And oftentimes those things will linger and they go unsaid and they can have a direct impact on performance and how our staff work with clients. We've made it mandatory that if there is a prolonged crisis, maybe a physical intervention or something occurs, that they sit with a supervisor or a clinician and they actually process and debrief through that event so that they, at least at a minimum, are getting some level of support and we can assess their readiness or ability to kind of go back and do the work that we need them to do. We also, as an organization, and Kristin can probably speak to this a little bit more than I, have a huge investment in our employee assistance program and utilizing that and directing our staff there when needed. So if in those weekly or biweekly supervisions, I'm seeing that a staff member is really starting to struggle, I'll make that as a recommendation for them to set up an EAP appointment and actually meet with somebody.
Yeah, and I don't think I really actually want to go more on that, if that's cool with everybody. I think it's also more in the sense of when we hire folks and we give them their full compensation package, I always from the jump talk about time off. It's really important that we're finding this balance between work and grind and playing and resting and having a good time in our personal lives. Again, it's all in balance. And I remember coming over as a full-time employee back in 2013 to join the executive team. And I said, listen, when I'm here, you're going to get 110% of me, but you need to know that if there's not a crisis going on, I'm present with my partner, my family, my kids, my dog, my grandson, all of those items. And that guess what, when you're off, I'm not going to bother you unless this place is burning down. So it's really setting up super healthy boundaries and knowing that your time off is your gold, and we encourage people to take time off. There's never any weirdness about that. Like, you got the time, use it. That's what it's there for. And that sounds real elementary, but I think it's a critical piece of what we've done. And we've put our money where our mouth is on that, which was a big transition for many folks that wanted to be constantly connected to their phone or their email when they were off. And we were like, no, take the time and just be with your people.
I think Kristin and Jeremy really answered that question, so well. I think for us, really holding that supervision time as sacred.
Yeah.
So many new staff, during the interviewing process, and we talked about what they needed, and what we found they weren't getting in their previous employment was good supervision.
Mhm.
And so we really hold that as very sacred here at the Family Center.
Well,
I'm aware that we just have a few minutes
Yep.
left. And what I would like to end with, let's say I'm a leadership position and I was to chat with you, each one of you, and we're having a cup of coffee. And I said, listen, really, should I take this on? What's in it for me? In what way is this going to make my life as a leader more satisfying and successful? I don't know if I should really get involved with this trauma-informed stuff and in the way you guys have. So, if we could just hear from you, why should I do this? Jeremy, could you just start with you? Like, why should I do this?
Well, I would probably start by asking you what your original why was for why you're doing what you're doing to begin with, and whatever that answer is to that question would be the answer I would echo back to you. Right? If you want better outcomes for clients and individuals, that's part of the reason why you want to do this. If you want a healthier, more vibrant work culture and environment where people enjoy coming to work, that's why you do this. If you want to challenge those systems that have been in place for 50 to 100 years, and we've always done things because it's the status quo and it's just the way we've always done business, that's why you want to do this, because this is the path forward to a new, innovative way of looking at mental and behavioral health, how trauma is impacting individuals. And if our expectation is to affect change in our communities, I would argue that you almost are going to have to adopt this at some point if you truly want to. So you don't need to be on board right now, but at some point the cost is going to be too great for you that you're going to want to get on board later on, and better to get on that train now, because we're all boarding up and we're ready to go.
Okay,
Absolutely.
you got me wanting to do something. I know that, Jeremy. Take some Ivy. What would you say to me, Ivy?
Jeremy really hit the nail on the head. There is a huge cost to not doing it, both in terms of a human cost and a financial cost. And so are you willing to pay that cost for not doing this? There is such a great benefit. The outcomes for the organization, the outcome for the staff, and most importantly, the outcomes for the individuals that you serve are so great. Why would you not want to take this on?
Agreed. I mean, you two really summed it up. It's that cascading effect and impact that I don't even think we understood what we were stepping into a couple of years ago when we really intentionally looked at this. The benefits are just profound. It's a landscape change. I don't know how else to say it.
Thank you, everyone. Tony, well, so thank you. I know we are at time. We have 1 minute, please, for our audience. First, I want to thank all of our panelists, Larry, Jeremy, Ivy, Kristin, for your time. I was taking notes. I could see you all learning from each other and taking notes as we went along. Tony, I want to thank you for facilitating a wonderful discussion. To our audience, I want to thank you for being here. I see many of the chats came in. I saw people really finding this helpful. Please, if you get a chance, complete our survey, give us feedback, but also let us know what other topics in this area would be helpful for you moving forward in guiding your decisions to become a more trauma-informed organization. So we want to thank you. Connor, do you want to put up a little bit of our upcoming events? And as I said, thank you to our panelists, to Tony, to our audience. Our audience, thank you for all you do and the amazing work that you do out there and your interest in this topic.
Yep, so we have an upcoming event on November 18th on reducing social isolation and loneliness with youth and families. And we'll also be announcing a few other November events in the next couple of weeks. So stay tuned for that. And as Jim mentioned, we'd really appreciate if you could just take the time to complete that brief feedback survey. It will pop up once the webinar closes, and the link is also in the chat box. And you can also visit our website, ctacny.org, to view past trainings, and the recording of this event will also be posted there in a day or two. So you can check out the recording if you want to take a look at that. And please also feel free to contact us via email at ctac.info@nyu.edu. So thank you so much for joining us. Oh yeah, go ahead.
I just wanted to say we will get that performance evaluation from Larry and post that with the video, the recording of this training as well. So just for those of you who are interested, many of you would. Thank you, Carmen.
Yes, yeah, that will be available. We'll post that in the next day or two. So thank you again to our panelists and our participants. I think this was a really phenomenal conversation. So we really appreciate you taking the time to join us today.
Thanks again,
Thank
everybody.
you.
Stay well.
Thank you. Have a great
Stay well.
day, everyone.
Take care. Bye-bye, and thanks again.
Bye-bye.